So for the lower back, in this particular plain film X-ray, we've taken a picture or a plain film X-ray of the lumbar spine, so from the side. And what I want to demonstrate or show to you is what we look for. So first of all, we look at the curve. There should be a natural lordotic curve and in the low back. And if we line up the back of these vertebral bodies, so if we took a pencil and went down the back of them, they should all line up. Sometimes you can get an anterolisthesis where one of these vertebrae actually shift forward on the other, and you'll be looking for a pars interarticularis fracture. But if we look at the intervertebral disc spaces, so this is demonstrated by the gap. As we go lower down, you can see that these gaps here are actually wider. So if you look at this, they're actually wider. Then as we get lower and lower down, around the 4th and the 5th lumbar segments, there's a decrease in disc height. And there's some early anterior osteophytes forming, traction spur osteophytes. And those are early signs of degenerative change and arthritis. So there's a decreased disc height between the L5 and the S1, and the L4 and the L5 with early degenerative change. And if we look at the close-up, the spot view, probably see it's homed in very nicely so that we can see what's happening. And as I've just said, we've got the reduced height here, and the symptoms that the patient is experiencing, luckily enough, aren't sciatica. They're not radiating pain, they're not numbness or weakness or tingling into the legs. There are negative orthopaedic findings for that. So luckily, the patient's able to be treated with proper chiropractic care and has made quite a good recovery to date. So, you know, an X-ray is important. From here, you could also go to MRIs in Australia. The chiropractors can refer to GPs, and in the UK, chiropractors can refer straight for an MRI or CT. Things work differently in America, maybe Canada as well. But it's always worth seeing a chiropractor if you have any kind of back pain, and we can help assess it, and we can help tell you whether we can help you, or we can put you forward to the next appropriate person that may be better placed to treat your problem and help with your symptoms. Thank you once again.